Whether or not your paralysis is short-term or long-term is a question you may not know the answer to yet. The reality is your doctors may not know the answer either. No matter what they might tell you, the truth is they probably don't know. If you have facial paralysis because of Bell's palsy, there is a great likelihood that the weakness will go away and you will eventually resume all use of your muscles and your nerves. Hopefully within a few weeks your face will be back to the way that it was before your Bell's palsy. However, the reality is that there is a percentage of the population for whom the facial paralysis becomes permanent from Bell's palsy. If your paralysis is a result of a brain tumor or procedure in the brain, traumatic brain injury, mine was from a brain tumor, the truth is your doctors probably don't know. I was told my first days of paralysis that within a few weeks my muscles and nerve use would return and I would be completely fine. Even within a few weeks after my surgeries, I was again told not to worry, and doctors told me that within a year's time they were 100% sure that I would be returned to complete and total use of my face, including all the muscles and nerves. However, as time ticked on, I realized that though they were hoping the best for me, as I hoped for myself and as my family also hoped for me, they didn't really know the truth. The reality of facial paralysis depends on many factors, only a few of which are within the doctor's ability to be able to determine. The nerves, in order to reestablish the connection between the brain communication and the nerves and muscles, the nerves recover at approximately a millimeter a day. And so depending on the location of a brain injury or a surgery, depending on the nature of your brain trauma, the nerves have longer period of time to travel or a shorter period of time to travel. For me, the brain surgeries took place around the brainstem area, which is all the way in the back of the head. So they had as far as possible to have to travel. And while the doctors hoped that there would be a complete recovery within a year, it was very clear after 6 months that that was not going to be the case. Of course, it was not clear to me, but it was clear to them. And only upon my follow-up visits did they then say that it looked as though I was not making progress as quickly as they had hoped. At the 6-month appointment follow-up, they indicated that maybe I would want to start thinking about the possibility of having some additional surgeries at the 12-month mark, or maybe going to some facial therapy at that point in time so that I could make full use or better use of those muscles and nerves that had not yet returned. That was news to me because up until that point in time, everything I had heard was that I would make a full and complete 100% recovery. How do you describe the emotions you might have upon finding out that you may have long-term facial paralysis? Probably the first emotion you will have is disbelief, shock. I felt I could deal with anything for a short period of time, but everything from sight loss, hearing loss, loss of the use of my facial muscles, I had always believed would return, and because of that, I thought that everything I was going through in the meantime would have an end. Just like going to school, you know that there will be an end date. You know that when you are finished, you will be a better person, a stronger person, you will know more. That's the assumption I made with my facial paralysis. As time went on, there were definitely tears, but there also came to a point in time where we started to come to grips with reality. For many, hopefully, the battle with facial paralysis, and I don't call it a battle because it will be the end of anyone, but because there will be challenges every single day. You will have to come to a new normal in life. You'll have to figure out how to brush your teeth, how to chew, how to eat, how to blink, how to function, how to smile all over again. Or for many people, some of those things may be things you won't be able to do anymore. You may not be able to smile with your full face. You may be able to smile only with the good half of your face. Hopefully, over time, you will regain some of the muscles and nerves. The most important advice that I would give would be to say, keep hope. Never give up the hope and faith that you will continue to get more and more back. And don't listen to the naysayers. The doctors may tell you that you won't make any more progress. They might tell you to be happy with where you are, but the reality is they don't know how much progress you can make. They are giving you their best estimates and basing their opinions mostly from experience, but they do not know your individual body. And as long as you continue to practice and have faith and have hope that you can get better, you can continue to get better. That doesn't necessarily mean that your muscles and nerves will return to the way that they were. But when your inner strength gets better, your outer strength is better too. So whether or not you know at this point in time if your paralysis is permanent or temporary, I would say keep the best outlook that you can. Move forward one day at a time and get ready to learn some new skills or learn some old skills in a new way. Practice, practice, practice. Perfect practice makes perfect. The same is true whether you're playing football, piano, learning to smile, or learning to chew. So, get ready.